Should I be concerned about bleeding after a positive pregnancy test?
Hey there! Welcome to this video where we'll discuss whether you should be concerned about bleeding after a positive pregnancy test. Congratulations on your positive pregnancy test result. It's an exciting time, but it's also normal to have questions and concerns along the way. One common concern that many women have is experiencing bleeding after receiving a positive pregnancy test. In this video, we'll address this topic and provide you with some useful information. So, let's get started.
Understanding implantation bleeding.
Bleeding during early pregnancy can occur for various reasons, and one possible cause is known as implantation bleeding. Implantation bleeding typically happens around the time when the fertilized egg attaches itself to the uterine lining. It usually occurs a week or so before your next expected period and is often lighter and shorter in duration compared to a regular menstrual period. Some women may mistake implantation bleeding for a period, especially if it occurs around the time they would normally expect their menstrual cycle to start.
Is bleeding normal during pregnancy?
While bleeding during pregnancy can be concerning, not all cases indicate a problem. It's important to remember that every woman's pregnancy is unique, and some may experience spotting or light bleeding without it being a cause for alarm. This is known as spotting, and is relatively common during the first trimester of pregnancy. Spotting is often harmless and can be caused by factors such as hormonal changes or increased blood flow to the cervix. However, it's always recommended to consult with your healthcare provider to ensure everything is progressing well.
When to seek medical advice.
While some bleeding during pregnancy may be normal, there are certain situations where it's essential to seek medical advice promptly. If you experience heavy bleeding, soaking through a pad in less than an hour, severe abdominal pain, or passing large blood clots, it could be a sign of a more serious issue. These symptoms could indicate a miscarriage, ectopic pregnancy, or other complications that require immediate medical attention. It's crucial not to ignore these signs and contact your healthcare provider right away.
Additional considerations.
Apart from the reasons mentioned earlier, bleeding during pregnancy can also occur due to other factors, such as an infection, cervical changes, or certain medical conditions. It's always better to err on the side of caution and communicate any bleeding or unusual symptoms to your healthcare provider. They are the best resource to assess your specific situation and provide appropriate guidance based on your medical history and individual circumstances. In conclusion, experiencing bleeding after a positive pregnancy test can be worrisome, but it's important to understand that not all bleeding during pregnancy is a cause for concern. Implantation bleeding and spotting are relatively common and often harmless. However, if you experience heavy bleeding, severe abdominal pain, or pass large blood clots, it's crucial to seek medical advice promptly. Remember, every pregnancy is unique, so consulting with your healthcare provider is always the best course of action to ensure the well-being of both you and your baby. Take care, and enjoy this exciting journey ahead.